We begin tonight in the Yukon, where there's frustration about rural Yukoners being discharged from the Whitehorse Hospital without a place to stay. Earlier this week, we told you about a man from Pelly Crossing sent to Whitehorse by medevac. He told the CBC he had to beg to stay at the hospital after being medically discharged in the middle of the night with nowhere to go. Cheryl Kawaja now brings us the story of a Yukon family frustrated with another hospital discharge.
Frances Van Kessel says she's furious about how a family member from Teslin was treated a couple of weeks ago at the Whitehorse General Hospital, discharged at night without a plan or even shoes.
She was brought in by the police under the Medical Healthcare Act, and she was wearing her pajamas. She was assessed by doctors and then was released to Whitehorse in the middle of the night with no shoes on, no winter jacket, and not proper clothing as well. She was wearing her pajamas and was told to find a place to stay.
Van Kessel says the family member had no wallet or ID. Van Kessel says she was able to step in and help, but she's frustrated.
It makes me so sad, but it also makes me so angry about it. Because I hear this over and over again, because this isn't the first time that this has happened to a person in the Yukon. This has been going on for years and years and years.
It recommended health lodges.
Speaking to CBC, Health Minister Tracy Ann McPhee said she was not aware of the details of the situation, but says her government knows it has work to do with the hospital to address discharge policies.
We have spoken to them about that in the past. This is certainly a gap. I don't know as well if we have data on how often something like this might be happening, but once is too many times.
The Yukon government has long committed to creating a travel lodge for people from the communities who need a space when accessing healthcare in Whitehorse, but that has not yet happened. Opposition parties continue to question why that has not happened. A cabinet briefing note from more than a year ago describes how the government is considering short-term alternatives, like reserving a block of hotel rooms, but that has not happened either. In August of last year, the government also conducted a survey asking people who had done medical travel about their accommodations.
Why did you spend all of this money on another survey that you're going to put on the shelf? You could have took that money that you spent on a survey, because we already knew there was a problem, and took that money and put it in an account for this, for these reasons. People who need a room for the night before they can get back to their community, or money for gas to get back to their community. It was a waste of money.
Van Kessel isn't optimistic anything will happen anytime soon. Cheryl Kawaja, CBC News, Whitehorse.